So what is breast tissue really made of? You might have heard or think that it's just fat, but there's more to it than just fat. I'm Dr. Wolf, I'm a pathologist, and this is part of my October series on breast cancer. In today's video, we're going to learn about the macroscopic and microscopic anatomy of the breast. We have to start at this point because you can't really understand the nature of breast cancer until you understand the nature of the breast anatomy. When discussing the anatomy of the breast, I really like to divide it into two parts. The first is the stromal or supportive tissue, and the other is the functional cellular tissue that is responsible for a lot of breast cancers. Any of these cells can actually produce tumors, but we're going to be focusing heavily on those epithelial layers that produce the most common types of cancer, which are invasive ductal carcinoma and infiltrating lobular carcinoma. So here's a very simple diagram to get us oriented. Above me here, this is the chest wall, so each one of these are ribs. The red material is the pectoralis major muscle, and anterior to that is breast tissue. Now, to go back to what I said about the stromal tissue versus the tissue that is functional, all of this fatty material here, fibrofatty tissue, is going to be the stromal or supportive tissue that does not really contribute to the major types of cancer. This is the functional unit. This is referred to as a lobular or terminal ductal lobular unit. Now, in the adult female breast, they can be divided into somewhere between 15 and 25 lobes, although these are not well defined like would be the lobe of a lung, for instance. When we look at a breast internally, we do not identify them by lobes. It's actually quite difficult. Everything just sort of looks like fatty tissue with a little bit of fibrous tissue, or you might see a little tiny blood vessel. So if you were to do a cross-section of a breast, you will not see stuff that looks like this. You will see stuff that mostly looks like this yellow material. These functional units are seen microscopically. But this is important to understand that these areas at the end, which are kind of greenish and kind of shaped like a shamrock almost, this represents the lobular portion, which then produces the milk, which enters the ductal system and travels to the nipple. Now let's have a look at what this really looks like. These are scanning electron micrographs of lobular units in the breast, okay? So you can see up here, they kind of look like raspberries almost, but these are very, very small. Again, microscopic, this is an electron micrograph, and here's a larger portion. So as you look at this, you can see that there are lobular units here, and then there are these kind of thin cells that separate them. And again, I'm referring to these thin cells that separate the glandular units. The glandular cells are the ones producing milk, but these cells are called myoepithelial cells. So these myoepithelial cells, it's pretty interesting because when the gland produces milk, these myoepithelial cells, remember in medicine, myo means muscle, meaning contractile. These cells actually contract, which squeeze out the milk and can squeeze down through the duct to the nipple. Now we're going to have a look inside of this. We're going to take a cross section and we're going to look at what we see in the light microscope. This is what it looks like when a pathologist is looking in the microscope. These are lobular cells, and every single one of these is a group of lobular cells. All of those are surrounded by those myoepithelial cells that we talked about. Here's a little bit higher magnification. You can see these little spindle cells here. Those are the myoepithelials that contract and kind of can squeeze the milk into the duct. All right, so back to our diagram. Each one of those lobules attached to a duct, which gets larger in caliber as it gets closer to the nipple. It is there to transport the milk through. And so when you have cancer of the lobular cells, that's the lobular carcinoma. And we will look at that in some of my videos this month. When it is occurring from the ductal cells, the cells in the tubing, that's the invasive ductal carcinoma. And so here's an example of breast cancer. Now, if you look here, all of this around on both sides is that yellow fibrofatty tissue. It's very unremarkable. That's what breast tissue looks like grossly. But here in the middle, you can see that it's dense and tan white and it's poorly circumscribed. This is the nature of breast cancer. In fact, happens because when those cells break through the basement membrane and they are defined as cancer at that point, the body reacts by producing fibrosis. It's called desmoplasia. And so as those become dense and fibrous, that's when a woman might feel a nodule. That's when a mammogram or an MRI might see the nodule because it becomes more dense than the surrounding tissue. And now we're getting a little bit into diagnosis, and that's what I want to cover in my next video. If you like this kind of content and you're interested in breast cancer or other types of pathology, please consider sharing this, liking it, commenting, or following the page. Thank you.